So now let's move on. In the next realm of disorders that we want to discuss, we have what are called the psychotic disorders. So psychotic disorders carry their own category. What is the main factor behind them is psychosis. Psychosis is this external illusion that you have on reality. You don't see reality the way reality is. You have a distorted, different, unique perception of what is reality. Not the way that everybody else perceives it. That's psychosis. Within psychotic disorder, within psychosis, there's a series of different disorders. But for now, let's focus on one, which is schizophrenia. So schizophrenia is the most common of all psychotic disorders. Schizophrenia is the most common, but it's not the only one. Let's focus for now though, what is schizophrenia? So schizophrenia by definition is a split mind. A split mind because you have a split across your thought, your action, your emotion. So your mind is not acting normally, your mind is disrupted. Within schizophrenia, there are a series of characteristics. And schizophrenia by itself most often goes off by the stereotype that it's only about hallucinations. And it's somebody that hears things, listens to things, hears things, sees things, but it's more than that. It's much more than that. Schizophrenia as a split mind can be conceived by what are called positive symptoms, negative symptoms, or psychomotor symptoms. Positive symptoms is that something is added. Positive means that something is given. So it's like addition. It's something that's being added. The addition might be, for example, a delusion. Delusions are inappropriate or obscure different thoughts. There can be paranoia. There can be delusions of greatness, delusions of grandeur, what they're called. Somebody that may think, one time there was a patient whose name was actually changed to resemble the name of a political figure. Famous political figure, out of respect, I'm not going to say the name, but this man actually believed that he was this political figure. That's a delusion. Delusions could be perceived in beliefs that are irrational. There was this one time that a lady would believe, a lady was another client that I happened to chance to work with. You know, in the surrounding borders of her house, she had this belief that the neighbor was spying on her, and the neighbor was hooking up like cameras to record her, and the neighbor was placing those on the branches of the tree that was growing in his backyard. So when the spring began, and there was a flourishment of that tree, if the branches were extended to her side of the house, she would come out with a machete. That was an example of a strong delusion of persecution. But as we move on now, the main thing are the most common symptom that most people report, and the main thing that gives it away for clinicians, psychiatrists, psychologists, is hallucinations. So hallucinations can range in a broad of different categories. Hallucinations can live on the world where they can be given by all five senses. So it can be auditory, it can be through things that you're listening to, it can be visual, it can be seeing things that no one else can see, it can be olfactory, it can be touch, and it can be taste. A couple stories that I can share for you. As far as taste, remember this one, it was a man who kept saying that he could taste silver, like if he was swallowing, like he was saying that as if he was swallowing a coin. He kept saying about it, that I have this taste. And that would be the stage where his brain would go off to have more and more dopamine. The production of dopamine is the main thing about schizophrenia. There was stories that I share very often. There was one time that a lady it's 3, 4 in the morning. It's only me and her in a small office talking. Um, she was hungry, so I brought her something to eat, and then she kind of, grabbed the napkin, kind of hides it like this, and she begins drawing. She asked me for a pen. I always had a pen like here, and I lent it to her because she was so calm, so peaceful. I didn't see any problem with it. Gave her the pen. She would hide it like that. Starts to draw. After a while, moves her hand away, like turns over the napkin, places the napkin in front of me, and she drew me this girl with like long hair, broken neck, big long black eyes, like a hospital robe. So imagine it's like 3, 4 in the morning, small office, only me and her, so this freaks me out. And then I ask her, what is this? And she tells me, it's the girl that I've been seeing behind you since I came in. Imagine that. And I remember having a conversation with a physician in the hospital where he's telling me, how impactful can that be? She's so calm about it that it's someone like she get used to it. That's the power of hallucinations. Now, within the realm of hallucinations can be internal or external. Internal or external implies that is it something that you're hearing like inside of you? Is it like a voice that you hear in your head? Or is it like external noises that you hear? The external noises that you may hear or the internal noises that you may be hearing can be logical or illogical. Logical meaning that it's actually words that you can understand, it's a language that you can understand. Illogical doesn't really make sense. People just hear like whispers, but they don't really say anything. It just, or like a different language than the one that you know of, and it's just noise, or it can be just noise around, you name it. But what makes it a little bit more severe, a little bit more dangerous are the levels of increment. So if you have a hallucination, say those specifically are auditory, and you hear them inside of your head, not externally, but inside of your head, they're logical. You can understand the language, you can understand what is being said. And commanding implies that it's telling you, you have to do this. So commanding hallucinations may tell a person you have to hurt yourself. You have to hurt someone else. If it gets to that level, then it's very, very, very dangerous. There can be different levels of how severe can this be. And usually people that fare off better with medication, treatment, are people that were doing good before. If you were doing good before, most likely you're going to do better after the treatment. But if you were not doing good before, and then you're hit with schizophrenia, it's far more likely that life will be very, very difficult for you. So it can be different levels, and it varies on how dysfunctional this can be, This is the main psychotic disorder, but it's not the only one. There's a series of different ones. The most common one that I would encounter in a psychiatric hospital is schizoaffective. So really quick, schizoaffective, schizo carries on the perspective of psychosis. So it's a split mind, but the phrenia is the affective component, affect being an emotion. So you have a little bit of a combination with schizophrenia and mood disorders. It can be a combination of schizophrenia with depression or a combination with schizophrenia with bipolar disorder. We can have a conversation on whether something can be primary diagnosis and secondary diagnosis, or the comorbidity being given as one diagnosis. If schizophrenia is the main dysfunctional factor, schizophrenia goes first. And if while the person is experiencing psychotic symptoms, the person may now feel depressed, may feel mood changes, instability in emotion, then schizophrenia goes first, and perhaps depression or bipolar disorder goes next. It's a secondary diagnosis. But if you have a combination of both schizophrenia and depression, but neither one is more powerful than the other one, like both are cellularly dysfunctional, at one point it can be the change in your mood what triggers psychosis, or it can also be that psychosis triggers the change in your mood. So you have a combination of both. That's when you have schizoaffective disorder. There can be disorders that are triggered by the use of a substance. So the use of a medication or the use of a drug leads to psychotic related symptoms, and that's a different type of a disorder. So you can read about the different types, but overall it all falls within the category of psychotic disorders, some of the most dysfunctional ones. And if you remember, around the world, 2 main disorders are still recognized, or only 2 disorders are recognized, and that's depression and schizophrenia. So take it seriously, and it is a real thing, and it is very dysfunctional. If you encounter cases of schizophrenia, it's people, humans, they just need help, need your help, need your skill as a professional. So not all cases are alike. Make sure that you're well studied and you know how to react properly if the situation arises for that. Good work.